Hi, I'm Dr. Molly with Your Goals Physical Therapy. If your shoulder impingement is stopping you from kayaking, this is the right video for you. In this video, I'm going to talk about how my client Penny overcame her shoulder impingement and got back to kayaking so much faster than she thought she would after months and months of dealing with doctor's offices and not feeling like she was getting anywhere. And she didn't have to have surgery. She didn't need any medication to get there. So let's get started. Kayaking. So Penny was telling me that she and her family just love outdoors adventures. So she's a mom with 3 boys, and her husband love to go camping and do all these outdoor recreational things. And so one weekend they put the kayaks on the car, and they went down to one of the little lakes around here. I think it was one of the nature preserves. And the family's all kayaking. Well, what good would any kayaking trip be unless there was at least a little bit of race or some antics among family members, right? So she's racing one of her sons, and she knew it when she did it. She just pulled really hard, and her arm went and did something weird, and she's like, I don't even understand how I did it, but I just knew my shoulder was going to be sore the next day. And she was perfectly okay with that. She's like, I know what I did. I know I irritated it, whatever. What she wasn't prepared for was that it would take months for that to stop. About a month after that weekend, she thought that had been enough of a break for her shoulder. It wasn't aching all the time. It was only a little bit. So they decide that they're going to go on another adventure and do one of the ropes courses where you're latched in, but you're high up and you're doing courses that are uneven. And so you have to do a lot of balance. So there's a lot of hanging on. She's like, I got up there and I was all ready to do it and just ignore my shoulder, but it just felt too weak and it was popping and I just didn't feel strong, and it was really, really uncomfortable. So she's like, I had to sit it out. So here I am with all the stuff, just waiting for everybody else to be done, having fun. And she's like, it was miserable. So that motivated me to go to my primary care, and they ordered x-rays, MRI to see if there was something going on in my shoulder. They said there wasn't anything that they found on the MRI, just a little bit of inflammation. So I was told to take these anti-inflammatories that they gave me a prescription for and rest it. So I rested it for another month, maybe longer because life gets in the way. And she was like, but it didn't get any better. So she called her PCP again, and they sent her to an orthopedic. So the ortho said the same thing. There isn't anything really wrong with your shoulder. There's a little bit of inflammation. If you want, we can do a cortisone shot now, and then here are these exercises that'll be good for you. If it gets worse, maybe we'll do surgery. If the pain just gets worse. And so you can come back. It's just, she's like, I don't want surgery. I just want my shoulder to stop hurting if there's nothing wrong with the imaging. And so she has a lot of conflicting information in her head. She goes home to kind of process some of that. But she's looking over the exercises that they gave her, and she's like, I don't have any idea how to do any of these. And so she's like, honestly, I didn't even look at them again. She's like, I was confused by reading the paperwork, so I just didn't do anything. The cortisone shot didn't help me at all. So here I am, still stuck. And they're basically telling me my only option if I go back to the doctor is surgery. So I'm not really sure what to do. She ends up finding me on the internet, and we talk. And when she comes in for the evaluation, I walk her through. She does some movement so I can see how her arm's moving. She shows me exactly when it hurts. I press on a bunch of things to see if we can recreate her pain and certainly make it better, because that's ultimately the goal, right? And we figured out that she has a shoulder impingement. So just for those of you trying to figure this out, shoulder impingement is really a mechanical so your arm is not doing a really good job of rotating inside of its joint. And so the bumps on your humerus or your arm bone are hitting the top of the joint space. And so you get this like pop, and it can be anywhere from just uncomfortable to downright painful. It just depends on where you are in this process. And so you're normally you're okay, you're okay, you're okay, you're okay. You get to about here and you're like, I know it's coming, I know it's coming. It's painful, it's painful, it's painful, and it's done. And so you're like, why just this little range? Why? But it really affects more than you would think it does. So when you're trying to put your dishes away, it bothers you. When you're folding laundry, it bothers you. When you're driving, it bothers you. And it's just this little annoyance that over time, by the end of your day, you're like, my arm is just achy and it needs to stop and I don't like it. And something has to be wrong because nothing lasts for 2 months. Nothing lasts for 6 months. Nothing isn't better with anti-inflammatories after months and months and months. And so, but again, during the eval, we were able to talk about that. Talk about how you take off the pressure, how you stop that pinch, what it is that we need to do to make her joint work correctly. And then ultimately to make sure all the other muscles around it are the right strength so that she can get back to kayaking. Because ultimately her goal was, I want to be able to go and enjoy my weekends with my family and not feel like I'm old and decrepit and not feel like I'm going to fall apart and not feel like I'm going to rip anything to shreds. I don't want another injury. I just want to get back to my life the way it was before I raced my kids. And I won, but I lost at the same time. So this is where she was. And we created a plan for her that worked for her and her lifestyle. Talked about all the things that she needs to do and exercises. She had the videos to do. And now we are on the other end, and this is a wonderful story because she was able to go back and kayak with no pain. I won't tell you she was full force because it was her maiden voyage afterwards, so she was a little bit hesitant, but she was able to get out there. She had no repercussions. She was not sore. Everything was wonderful. She did race a little bit, but she was still very guarded. But she says that she knows that her shoulder is a lot better, and she knows that with continuing what we've been working on, she'll be able to get a lot stronger. And so Penny is just super, super excited now that she is back to fully her again and not feeling old and decrepit. So if this is the type of care that you're looking for, I have a few things. I have a book that I put all of my best tips for shoulder pain. So if you're just looking for a little bit more information, to get to know me better or just to find out a little bit more information, I put all my best tips in my ebook. It's a shoulder pain ebook, and I will leave a link to that in the below this video, and you just click a button, fill out a little form, and it'll send it right over to you. Or we can set up a one-on-one meeting. I call them discovery visits. And basically, we just get to discover if we will work well together, if I will be able to help you get back to your goals. Because ultimately, at the end of the day, you should never be seeing any medical professional that is not going to be able to achieve the goal that you're looking for. If you're trying to get back to kayaking without any shoulder pain, come and talk to me. We'll create, and during this discovery visit, we'll talk a little bit about what your goals are. I'll be able to see you face to face, see how you're moving, and make sure that I'm the one that can help you get there. So I hope that you are having a lovely day and that you have kayaking on your to-do list for this month. You have a great day.